Well, I got interested in bioglass, at least the use of glass in medicine and dentistry, about 20 years ago. When we first started working on a method to treat patients with liver cancer. And in this particular case, we developed some glass microspheres, which are now made radioactive. They're injected into the bloodstream that goes to the liver, and the blood carries them into the tumors in the liver, and they irradiate those tumors and hopefully destroy them. Liver cancer is a very tough form of cancer to treat. So that was the initial interest, and in fact that led to a spin-off company where we now make those microspheres. Then I got interested in the types of glasses that Larry Hench developed about 40 years ago, where when you put them in the body, they react with the body fluids, bond to bone, and basically become a part of the body. And there's lots of applications for that. Our population is growing older. Our bones are wearing out as we grow older, and so there's a lot of fractures, a lot of repair work. And so now we're developing glasses which can react in special ways when they're in contact with the body fluids and convert into materials that are a lot like bone. Glass is very useful in that way, in that the body seems to like it, unlike a lot of metals where the body tends to wall them off. So there's a lot of future in working with companies that are developing products now that are used to repair broken bones, people who have osteoporosis, their vertebrae disintegrates, and now they have a material that I call it like caulk, bathroom caulk, and they make a little incision along your spine, and they work this little caulk gun in there to where the vertebrae is broken, and fill that vertebrae up with this caulk, and in about 5 minutes it's hardened, and you've got a vertebrae now that is stuck back together and will support a load. That's just a few things that is hopefully on the horizon for people in the broad field of what we call bioceramics. Metals and plastics or polymers are sort of foreign bodies to the body. Our body is basically composed of those elements like calcium and sodium and silica and other minerals that we find in ceramic products. And so the surface that a glass presents to the body basically is oxygen, whereas if you had a metal where you had iron, which is a totally different type of element, and the body doesn't recognize it as readily as something like glass. Now there are some glasses that you put them in the body and they're bio-inert. Piece of glass gets in your finger like window glass and may stay there for many, many years. We're not talking about those glasses, but the body doesn't tend to reject many glasses like it does other materials. These glasses will react with the body fluids, and over a period of time they change their composition entirely. Some portion of the glass is just eliminated through the body, and then other parts get incorporated into things that would just look like artificial bone. And of course you can make different shapes out of glass, pull it into a fiber, or you can make it into a sphere. We do a lot of work with spheres made out of bioglass. And those can be used to, like, if you had a bony defect or say a tumor in a bone where a surgeon had to remove that tumor, the bone by itself now may be too weak to support a load, if it was in the leg. You simply would take some of these particles, spheres, or particulates of the bioactive glass, put it in that site, and in a matter of a few weeks to a few months, now hopefully bone is growing through all those particles, filling the cracks and crevices, attaching to particles and bonding them together, and now you'd have instead of having a defect in your bone, that spot would all be filled in, and you'd have now the strength of the bone and normal function. Well, some of the more recent work is showing that the glass, when it reacts with the body fluids, it releases certain elements such as calcium, which is very important to our body, and also silica, which ceramists use a lot of. We make a lot of things out of silica, good old sand. And those two elements are believed now to actually turn on the genes that control different processes in our body, like the building of bone. So not only do you provide the elements necessary to create bone, but the first thing, the body has to signal the cells there, we need bone in this place, and to start those chemical processes that lead to bone. So it appears that the release of these elements from glass actually is playing a role in turning on, let's call them, bone building genes. We use the plumbing of the body, in this case, to deliver these radioactive microspheres to a particular site. We just inject them into the bloodstream that's going to the liver, the blood carries them in there, and then we make these beads of a size that they'll enter these tumors, but they're too large to go all the way through. So we use the liver as a big filter, and that's how they become lodged there. A person has a radioactive liver for about 3 weeks, but they go on about their normal life because the radiation can't escape from the body. And the advantage of that method is that you can give a patient a much, much larger dose of radiation in a safe fashion without doing any damage to the patient. These patients receive what would be 10 to 100 times a fatal dose of radiation if it was delivered in any other way. The purpose is to actually destroy the tumor in the liver, so you don't care what happens to it. But you don't want that radiation going out into healthy portions of the liver and destroying or damaging it. So this is a very localized form of radiation. Could it be used for other organs? Yes. Any organ that has a capillary bed and basically a controlled blood supply where you could just inject the beads into the blood. In animals, we've tested them in the use of kidney cancer, and another major application would be in treating rheumatoid arthritis, the joint area. There's an old wives' tale that people who had rheumatism or arthritis would often go and sit in certain caves, and they said they felt better in doing that. Well, no one knows for sure, but the theory is that, there's radiation in natural rock. And so when you're surrounded in a cave with natural rock, you're getting a certain amount of radiation coming there. And it just may be that in these caves where they observed some beneficial effect, that those rocks had a radioactivity level above normal. Now, it is known that if you inject radioactive particles into a diseased joint, which means that it has rheumatoid arthritis, the symptoms, the swelling, the tenderness, the pain is actually reduced or eliminated. And in Europe, people receive shots of radioactive material into their joints routinely. But in the United States, that's not the case. And so it's not permitted to treat rheumatoid arthritis with these radioactive materials in the United States. But we found that, and the problem is the leakage of the radiation. These glass microspheres don't leak any radiation. And so we did animal experiments where we injected these little microspheres. Now these microspheres are about the third the diameter of a human hair, so they're very small. But still, when you would inject those into a joint, you'd think, oh, that sounds a little bit like throwing sand in the transmission of my car. You know, that's not going to do good because these little beads may get between the bones and actually wear away the cartilage on the bone. But we found that that doesn't occur at all. The beads actually become embedded very quickly in the tissue that surrounds the joint, and they're embedded in that tissue. They're not floating in the liquid that's in the joint. And so we did some experiments with rabbits just to see if there was any mechanical damage, and there wasn't any. And then you can induce chemically arthritis in a joint. And the people doing that then would inject with the beads. They found a beneficial effect there, but it really hasn't gone beyond the laboratory stage. Prostate would be another organ that could be treated this way, but there's other radioactive materials used in treating a prostate. At the Cleveland Clinic, they used it to treat tumors in the brain. Tumors in the brain usually are isolated, and if they catch them soon enough, they can be surgically removed. But oftentimes the tumor will have little tentacles or part of the tumor going out into the healthy surrounding brain, and that's a very delicate operation, and the surgeon doesn't want to cut away anything more than absolutely has to. So the idea here with the radioactive microspheres is the surgeon removes the tumor, and then they put like a jelly-like material in that site that would contain the radioactive beads, and the radioactivity goes out a few millimeters then into the brain tissue, and if there's any of these malignant tentacles out there, they would kill them that way as opposed to surgical removal. That worked fine in rats, but it hasn't gone beyond the animal stage. It takes a long time, and we started working on the microspheres for treating liver cancer, and it was almost 20 years before it became an FDA-approved method. So there's a long lead time.